why do we adjust babies and kids? If we think back, first of all, to pregnancy, which is where a lot of these problems start, most people now are living in quite a stressful life. They're going all the time. Not many people are looking after themselves or exercising. So by the time they get to the actual delivery time, their pelvis is normally pretty tight, even if they don't feel pain. Going then through a normal birth process is already quite stressful for baby. They have to do a lot of movements, there's a lot of pressure, and then even with, as I say, a normal delivery, there's still a little bit of counter pressure on baby's head, which can cause strain on their neck. Then added to that, if you happen to have a C-section, forceps or ventouse delivery, there's a lot more strain going through your baby's neck just to get baby delivered. Now, I'm not saying any of these are wrong, of course they're not. They're all done whenever they're needed to be done and for safety of mommy and baby. But what it ends up then is with a baby who has had more pressure put through the upper neck than needs to. It's found that even in normal deliveries, up to 80% of babies have been found with tension in their neck. So it's not saying that nobody has done anything wrong. It's just the way things are going at the minute. There's more medicalised births than natural straightforward births at the minute. What that does and what this part of the neck controls really is our stress response. Now, stress response in an adult looks like a person who's rushing around, trying to get everything done, most of us at the minute, just trying to survive. And what that is telling our brain is that we're running away from danger. We're not really pausing at the minute. We're telling our bodies to go all the time and not rest. So that's putting our bodies in a fight or flight situation. The same is true for baby. Obviously, baby can't get up and run away, but they have the same symptom of the stress response. So if you imagine a bear running after you, what you want to do is run, obviously. So a lot of the blood supply and tension goes to the muscles of the arms and legs to get you to run away quicker, and the shoulders. So that's why most people sit like this here. So we want to run or fight. You know, that's the two main positions for there. Our heart rate and our breathing go faster because we need to pump all that blood and oxygen out to our muscles to go faster and farther away. The sleeping then can be an issue, and this is what happens mostly in babies, or you see it mostly in babies. If there's something running after you, do you think you'd be able to switch off and have a good sleep? I don't think so. You're going to be in a lighter sleep, so if something does come, you're able to jump up and run away quickly. In a baby, this looks like a restless sleep. Baby's moving all the time, baby's waking up very frequently, not settling, not ever really relaxing enough, even in their daytime, in their awake time. So that's one of the main issues why people come to see us. Obviously, we can't say we treat sleeping or we treat sleep issues, but that is one of the issues that chiropractic can help with, because we calm down the stress response so baby sleeps better. The other thing that happens then with your digestive system, your upper digestive system works harder. So in adults, that looks like indigestion, reflux, not really wanting to eat well or not eat often. In babies, that looks like unsettledness. They don't want to either take bottle, they spit up more frequently, they may have symptoms of reflux and colic and things like that, like they don't want to lie on their back. I think at the minute a lot of babies are overdiagnosed with reflux. I don't think all the babies who are diagnosed with it have it. But the medication given them and the milk changes given them can help with some of the stress there. But really what we're doing is calming down that stress response so the wee tummy relaxes and it takes in the milk and it breaks down the milk well. In the lower digestive system then, the stress response looks like a baby who can't wind, who can't get wind up or out, and a baby that's constipated or doesn't want to go to the toilet. If you remember again, if you're running away from a bear, you have time to go to the toilet. You're going to hold it all in. So that's what babies do. So by getting adjusted, we help relax the wee system very, very carefully and very gently, as a baby adjustment often looks like we're just using our 2 fingers, and it often looks like we're just doing that to their wee body. So we're just holding it till it releases and relaxes, and then its body works as it should, which is a baby that sits contentedly, obviously not for very long because they don't sit for very long, but a baby that sleeps, a baby that eats, a baby that goes to the toilet well, a baby that relaxes and kicks around and moves when it wants to in between as well.